everyone, thank you all for watching my videos and for subscribing to my channel. So today I would like to talk to us about a very important topic. But before I start, I would like to gist us about some events that happened during my junior medical posting. Please stay with me. Mr. O, a 50-year-old man, presented to the clinic on account of a wound he had on his right foot, which has refused to heal for the past 3 months. A detailed history was taken and he admitted to few other symptoms like increased thirst, frequent urination, and some degree of weight loss. For Mrs. A middle-aged woman, she presented on account of recurrent vaginal infection. Again, a detailed history was taken and she admitted to some other symptoms like weight loss, weakness, and increased hunger. Then there was this fine young man, a 28-year-old man, who presented because he had problem with his sight. He said he keeps eating cars in front of him and he could not even drive at night anymore. Again, he admitted to similar symptoms I just described. I recently read the story of a 17-year-old girl who described her symptoms of thirst as feeling like she was in the desert. She drinks anything she could lay her hands on. She said she could urinate 20 times in a day. It was that bad. For all the 4 cases I described, a detailed history was taken and several investigations were carried out. It was then discovered that they were all suffering from diabetes. Type 2 diabetes for the first 3 cases and type 1 diabetes for the 17-year-old girl. According to World Health Organization, the number of people with diabetes rose from 108 million in 1980 to 422 million in 2014. Diabetes is a major cause of stroke, kidney failure, heart attack, lower limb amputation, and blindness. Sadly, some people don't even know they have the disease. In 2016, diabetes was the 7th leading cause of death worldwide. In this video, I will try as much as possible to tell us what we need to know about this disease. Please don't go away. As an introduction, diabetes is a common disease that occurs when your blood sugar or glucose is too high. High blood sugar level is called hyperglycemia. So diabetes occurs because either the pancreas can't produce enough insulin or the cells in your body have become resistant to insulin. So there's an organ in the body called pancreas. I have an image here. I don't know if you can see this image. This is the pancreas, right? So pancreas produces insulin. Actually, the pancreas has different cells, each producing different substances. And one of the cells of the pancreas is the beta cells, which produces insulin. Other cells are alpha, the delta, and the PPP cells. So the work of insulin is to control blood sugar levels. Insulin helps to take in glucose to be used for energy. So the work of the pancreas is to secrete insulin. So if for any reason at all the pancreas is not producing insulin, maybe there is a problem in the pancreas and it's not producing insulin, or the pancreas is functioning very well, it's producing insulin, but the body is not responding to the insulin that is produced, there will be problem, right? The normal fasting blood sugar level for someone without diabetes is between 70 to 99 milligram per dl. If you convert to millimole per liter, you get 3.9 to 5.5 millimole per liter. And how do you make the conversion? If you're converting from milligram per dl to millimole per liter, you just divide your value in milligram per dl by 18 to get the value in millimole per liter. The normal random blood sugar level for someone without diabetes is between 126 to 199 milligram per dl. So if you convert to millimole per liter, you get that value. I will talk more on the fasting blood sugar and the random blood sugar level before the end of the teaching. I would like to quickly talk about prediabetes. Prediabetes means that your blood sugar level is too high to be called normal, but not high enough to be called diabetes. What do I mean by this? It's a little like being in limbo. And what does that mean? I mean, you can take steps to halt the progression of prediabetes to type 2 diabetes, right? Most people who have this condition probably don't know they have it, and this is because there are usually no symptoms. Types of diabetes. There are many types of diabetes, but for the purpose of this teaching, I would stick with three. And that's the type 1 diabetes, type 2 diabetes, and the gestational diabetes. So let's start with type 1 diabetes. Type 1 diabetes occurs because the insulin producing cells of the pancreas, which is the beta cells, are damaged. I already said one of the cells of the pancreas is the beta cells, which produces insulin. So in type 1 diabetes, these particular cells, the beta cells, they are damaged. So in type 1 diabetes, the pancreas makes little or no insulin. So sugar can't get into the body cells for use as energy. Type 1 diabetes is the most common form of diabetes in people who are under the age of 30, but it can occur at any age. Please take note of that. Now to type 2 diabetes. In type 2 diabetes, the pancreas makes insulin, but the body is not able to effectively use it. So in type 2 diabetes, there's no problem with the pancreas. The pancreas is functioning well, but the insulin that is produced by the pancreas is not being used effectively by the body. People with type 2 diabetes are said to have insulin resistance. Middle-aged or older people are most likely to have this kind of diabetes, but it can also affect younger age groups, mainly because of obesity. Please take note. And what do I mean by middle-age group? People above 45 years of age, but it can occur at any age. Type 2 diabetes is the most common form of diabetes, right? Gestational diabetes. This occurs when a woman who is not a known diabetic patient becomes diabetic during pregnancy. The blood sugar level usually returns back to normal within the postpartum period, and the postpartum period refers to the first 6 weeks following childbirth. So if a woman actually has gestational diabetes, it is expected that within the first 6 weeks following childbirth, the blood sugar level should return back to normal. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. Some risk factors have been identified for gestational diabetes, so I'll quickly mention them. Being overweight or obesity, lack of physical activity, previous gestational diabetes or prediabetes. By previous gestational diabetes, I mean a woman who has had gestational diabetes in her previous pregnancy has a higher chance of developing gestational diabetes in subsequent pregnancies, or a woman who has prediabetes. I already talked about prediabetes in my previous slide. So such women have increased risks of developing gestational diabetes. We also have polycystic ovarian syndrome. Polycystic ovarian syndrome is a common condition in women which is characterized by irregular menstrual periods, excessive hair growth, and obesity. So it's a risk factor for gestational diabetes too. It's also a risk factor for developing diabetes. Diabetes in an immediate family member. It's a risk factor for developing gestational diabetes. Then the race. Gestational diabetes is commoner in blacks, Asian American, and Hispanic when compared to the other races. Right? Now to the causes of diabetes. The exact cause of diabetes is unknown, but from research it appears that there is an interplay between genetics and environmental factors. So the following risk factors increase your chance of getting diabetes. So for easy learning, I divided them into modifiable risk factors and non-modifiable risk factors. So by modifiable risk factors, I mean factors that we actually have control over, that we can try to modify our lifestyle or something to avoid getting diabetes. Then we have the non-modifiable risk factors. These are the factors that we don't have any control over. Like, I would start with non-modifiable risk factors. One is family history of diabetes or a personal history of gestational diabetes. So for family history, if you have a close relative who has or had diabetes, you have an increased risk of developing diabetes. Then if as a lady you had gestational diabetes during the course of any pregnancy, then you have an increased risk of developing diabetes. Another one is race. Diabetes is commoner in blacks, Asian American, and Hispanics. Sorry. Another one is injury to the pancreas. This is especially important in type 1 diabetes. We said in type 1 diabetes, it is as a result of damage to the beta cells, which is supposed to produce insulin. So if there's an injury to the pancreas as a result of infection, tumor, surgery, or an accident, it is a risk. Autoimmune disease. By autoimmune disease, I mean disease that occurs when your immune system attacks its own tissues, and this is also linked with type 1 diabetes. An example of autoimmune disease are pernicious anemia, vitiligo, autoimmune gastritis, and the likes. Age is another risk factor. Risk increases with age, but these days there is an increase of type 2 diabetes in children and among young adults. Another one is polycystic ovarian syndrome. I already mentioned that. Polycystic ovarian syndrome is a common condition in women that is characterized by irregular menstrual periods, excessive hair growth, and obesity. I will talk more on polycystic ovarian syndrome in another video. Modifiable risk factors. High blood pressure. High blood pressure is linked to an increased risk of type 2 diabetes. Abnormal blood cholesterol and triglyceride levels. Low levels of high-density lipoprotein, and that's the good cholesterol, has been linked with an increased risk of developing type 2 diabetes. So also high levels of triglyceride. Triglyceride is another form of fat. It is also linked with an increased risk of developing type 2 diabetes. Smoking, being overweight or obese. The more fatty tissues you have, the more resistant your cells becomes to insulin. Then the use of certain medications, which include steroids, beta blockers, thiazide diuretics, etc. Symptoms. Symptoms include increased thirst, increased hunger, especially after eating, dry mouth, frequent urination, unexplained weight loss, even though you are eating and feeling hungry, feeling tired or weak, blurred vision, numbness or tingling sensation in the hands or feet, slow healing sores, dry and itchy skin, frequent yeast infections or urinary tract infections. Diagnosis. The following tests are used for the diagnosis of diabetes. One is fasting blood sugar test, oral glucose tolerance test, random blood sugar test. For fasting blood sugar test, this measures your blood glucose after you've gone at least 8 hours without eating or drinking, but you are allowed to drink water. And it is used to detect diabetes or prediabetes. So this table shows the blood sugar results in milligram per dl and the diagnosis. So if your blood sugar result is 99 and below, that's 70 to 99, that is normal. If it's between 100 to 125, that's prediabetes or impaired fasting glucose. If it is 126 and above, it is diabetes. But then, before you can actually make a diagnosis of diabetes, you have to confirm this results by repeating the test on a different day. Another one is the oral glucose tolerance test. For the oral glucose tolerance test, you must have fasted for at least 8 hours. So when you get to the clinic, your healthcare provider will measure your fasting blood sugar level. Then you'll be given a liquid containing glucose. Then after 1 hour, your healthcare provider will measure the blood sugar level, and it will do same again after 2 hours. So I have a table here. So the 2-hour blood glucose results in milligram per dl and the diagnosis. So if you get a value of 139 and below, that is normal. If it's 140 to 199, that's prediabetes or impaired glucose tolerance. If it's 200 and above, that's diabetes. But again, you have to confirm by repeating the test on a different day, right? Research has shown that oral glucose tolerance test is more sensitive than fasting blood sugar test to determine diabetes and prediabetes, but it is less convenient to administer, right? Now, random blood sugar test. A random blood sugar level of 200 mg per dl or more plus presence of the following symptoms can mean that you have diabetes. 1. Increased urination. 2. Increased thirst. 3. Unexplained weight loss. Other symptoms include fatigue, blurred vision, increased hunger, recurrent infections, and sores that do not heal. Your doctor will check your blood sugar level on another day using the fasting blood sugar or the oral glucose tolerance test to confirm the diagnosis of diabetes. So from a random blood sugar test, you still have to do the fasting blood sugar test or the oral glucose tolerance test. And what do I mean by random blood sugar test? This means the test can be carried out irrespective of whether you've eaten or not. So it can be carried out at any time of the day. Now I have an image here showing a glucometer. So this is a glucometer, and as you can see, the values are in milligram per dl. So like I said, you can convert from milligram per dl to millimole per liter, and from millimole per liter back to milligram per dl, depending on the one you are conversant with. So the figure here is 108. So if you divide by 18, like I said, for you to convert from milligram per dl to millimole per liter, you divide by 18, you get 6. That makes this 108 milligram per dl is 6 millimole per liter, right? So this is what a glucometer looks like, and it is what you can use to measure your blood sugar level. Yeah, this is another one. This one is actually in millimole per liter. So there are different ones. This one is a millimole per liter. So for you to get your value in milligram per dl, you multiply this one by 18. This is 4.7 here. If you multiply by 18, you get 84.6 thereabouts, right? New guidelines use glycated hemoglobin A1C as a screening tool for prediabetes or diabetes. An HbA1c of 5.7% to 6.4% is consistent with prediabetes and marks a time when it can be reversed by lifestyle changes. An HbA1c of 6.5% or higher is consistent with diabetes. Let me quickly talk about what glycated hemoglobin is. Glycated hemoglobin shows what a person's average blood glucose level was for the past 2 to 3 months. This can help to determine how well a person's diabetes is being controlled over time, right? Thank you all for watching this video. If any of the symptoms I described looks like you or someone you know, please encourage them to visit the hospital. You yourself, if it's you, please visit the hospital. If you have any question or clarification, please use the comment section. Next time, I'll talk about prevention, management, and complications that could arise from diabetes. Till then, keep telling people about Men Talks with Debola. Bye.